while, the rule was simple: don't mix and match vaccines. But that could be changing after a study from the National Institute of Health found the approach to be safe and effective.
This study suggests that perhaps people who've initially received J&J go on to receive a mRNA booster.
Here's how the study worked. More than 450 people volunteered and were separated into groups based on their original vaccine. They were then given one of 3 boosters: Pfizer, Moderna, or Johnson & Johnson. After that, their antibody levels were measured 2 weeks and 4 weeks following their shot. And even though all vaccines gave protection, the data shows people who initially received Johnson & Johnson but got Moderna and Pfizer boosters had a better immune response than sticking with the J&J shot.
We know that it had produced lower immunogenicity, and so this would not be inconsistent with what we've seen previously.
This new research comes as millions already received a Pfizer booster shot since its approval last month. And the extra dose is now outpacing the number of people receiving their first and second shots. For example, here in Indiana, close to 3 times as many Hoosiers received a booster shot in one day compared to those who signed up for their first dose.
This would open the door to the Moderna and the J&J folks to also get that booster.
As the demand for booster shots grow, the potential to mix and match could be a game changer in the fight against COVID. The FDA Advisory Committee plans to review the data on Friday.
Now, as this study waits for FDA approval, there are 2 other manufacturers that have a different request. Moderna and Johnson & Johnson have both submitted for emergency use authorization for their booster shot. A panel of FDA advisors meets tomorrow to review the data on both versions. If the FDA and CDC both sign off, Americans could start getting their boosters later this month. So you might be wondering, who again can get the booster shot? Well, right now the CDC recommends boosters for people who are 65 and older, people 18 and older in long-term care settings, and people 50 to 64 that have been diagnosed with underlying medical conditions. The CDC also says people 18 to 49 with underlying medical conditions and people 18 to 64 with a higher risk because their job may also go get the booster shot now. This viral tweet has been going around since late August and recently started making the rounds again on social media, places like Facebook and TikTok. And these claims here are pretty large. So we wanted to take a look at what it says. Let's start with the first. It claims that Donald Trump and every other living U.S. president are all vaccinated. We found out Jimmy Carter, Bill Clinton, George Bush, and Barack Obama all appeared in a vaccination public service announcement in March. The White House even tweeted the video showing the former presidents and their wives getting the vaccine. President Biden and the First Lady, Dr. Jill, received their doses before the inauguration. And a Trump advisor confirms that both former President Donald Trump and his wife Melania received the vaccine before Biden's inauguration. Now the second claim, that all 50 governors, both Republican and Democrats, are all vaccinated. According to Business Insider, as of June, all of them had received the shot. The Alaska governor was the last to roll up his sleeve. The next claim, that nearly 100% of Congress is vaccinated. Now, it's pretty unclear how many members of Congress actually are fully vaccinated. There is a survey from CNN, and it indicates that only 81% of members of Congress have reported getting the shot. This includes 100% of congressional Democrats, as well as 54% of House Republicans and 92% of Senate Republicans. But since this reporting relies on an honor system, an exact rate really is hard to pin down. Now, CNN reports that 97 House Republicans refused to disclose their vaccination status, so the number could be higher than that 81%. The next claim in the Post is that 96% of physicians are vaccinated. For this, a survey by the American Medical Association taken in June, the answer is yes. However, the number may have gone up since that survey was last done. And now the last claim, that 75 to 80% of the military is vaccinated. That's actually too low. The military reported just last week that 92% of active duty troops have been vaccinated. Deadlines for each branch's mandatory vaccine requirement are approaching in either November or December, so look for that number to continue to climb. And now the last line in the tweet. According to the Biden administration, that number was true for May of this year. The CDC says that nearly all deaths from COVID now are in people who are unvaccinated. And right now in the state of Indiana, in the fight against COVID-19, the state reported today more than 2,700 positive cases. This is nearly 1,200 more cases than yesterday. 32 more people have died due to the virus, and more than 3,900 more people in Indiana are considered fully vaccinated. Now, despite more people getting shots in the arms, the pace of doing that is slowing down in Indiana. COVID-19 vaccinations have fallen to its lowest level since the shot became available last winter. The state health department shows that Indiana continues now to lag behind the national vaccination rate. And remember, you can always get the latest vaccine headlines sent straight to your phone. All you have to do is text the word vaccine to this number there on your screen. And that is a wrap of tonight's big story.